Thanks.
You have to remain 6 minutes. Robbie's time, I'm kidding.
I can make it work. I may be done in 5. Now, there's actually a couple issues I want to talk about today. Some things that we did last year, some things we want to look at for this year. And the first one I'll talk about is the 911 telecommunications. Essentially, one of the things we're looking at with them is our staffing model has remained unchanged since 1996. But yet, the volume of stuff that they deal with and the other agencies that they serve have grown over the years. But before, and even last year when we went through the budget process, I could tell you the 10 or 33,000 calls on the computer a year, but what does that mean to the user of that system, the people that call 911? What does that mean to them? Did they get us on the first ring? Did they get us on the 10th ring? Did they have to wait on hold? We've got 8 911 trunks and 2 operators, so if more than 2 ring at one time, somebody's going to be put on hold. But we talked to those folks. Did we leave them on hold for 3 minutes, 5 minutes, 10 minutes? And did they hang up before we even talked to them? And up until this year, we weren't going to be able to even give you that data. We couldn't give you any kind of facts to say other than my opinion on what we thought they were doing. Well, the good thing with this year, with the new telephone system that actually got installed late last year, we can break all those numbers down. We can tell you when people call us. We can tell you how long it took us to answer. We can tell you how long they were on the phone. We can present all that information in a factual presentation. So we can look at our staffing to see if we're meeting the needs of our customers. So that's one of the things that we're planning on doing this year, is to make sure that we've got that under control. And if we come in the budget process and we ask for anything, we have the facts to tell you that this is what we need and why we need it. One of the other things we worked on this past year, most of you remember we took out some equipment money out of our EMS budget and we squeezed some money under our salaries to work on our staffing better. I can stretch things quite a bit, and we actually ended up stretching those folks into what now is our minimum staffing policy. For basically 6.5 days a week, we have 5 ambulances on duty in Macon County. There's 3 in Franklin, 1 in Highland, 1 in Alabama. Our minimum staffing policy is to keep 4 in the county at all times. And basically what that means is we have a trip out of Angel going to Mission, we're still at 4. We have 2 in Franklin, 1 in Highland, 1 in Alabama. If we have a trip out of Highlands Cashers that goes to Mission, the crew out of Highlands takes it, the crew from Franklin goes to Highlands to cover them, and we're still back to our minimum of 4 folks. What we're seeing is that's actually becoming more of an issue with the changes that have been going on with the healthcare system. And the other issue we have is I can only stretch so much, so we had to pick a 12-hour period during the week that was supposedly our slowest period of the week. Well, we picked 8 o'clock Sunday night till 8 o'clock Sunday or 8 o'clock Monday morning. The 12-hour period from 8 o'clock Sunday night to 8 o'clock Monday morning. We dropped down to 4. We have 2 in Franklin, 1 in Highlands, 1 in Alabama. One trip out of town that comes into that 12-hour period takes us below our minimums. And we haven't stopped service. We still take the trip. We still move on. But what we've been doing is we'll call in our part-time folks. We'll have them come in and we'll call and have them cover the base when these folks are gone. The alarming fact that we have seen over the past several months is that we're using those folks on a more than regular basis. 9 out of the last 10 weeks on that 12-hour period from 8 o'clock at night till 8 o'clock Monday morning, 90% of the time we've had to call a crew in from home because we've got trips out of town and we went below our minimums. What does that mean? Well, number one, that means if we drop below that minimum, still got 1 ambulance in Highlands, 1 ambulance in Franklin, 1 ambulance in Alabama. But particularly that 1 ambulance in Franklin has got to cover all the way from the Georgia line to the Swain County line to the Jackson County. That 1 truck in Highlands, they end up somewhere way down in Clear Creek or way down 106. They have no hope of getting anybody anywhere close to the end of their district. So we tried our best to work with those folks and bring folks in and provide that coverage, but I can see that we're going to have to look at that in the future because that's just unacceptable for us to drop down to a minimum of 4 ambulances. It's just not acceptable for the citizens. With that being said, we've also had some issues with the same issues that Robbie had with the Affordable Care Act and retirement. Just like Derek was saying, when a 24-hour shift on a regular basis puts us over those numbers. One of the things we talked about was we're already paying out the money. Believe it or not, our salary money is actually okay. I looked at numbers last week and we were running about 49%, but they're right where we want to be for half the year. So we're still maintaining our budget on full-time and part-time people, but we're spending the money anyway. And if we're going to get into a problem somewhere with these folks being over their hours, then we may need to look at just making those folks permanent part-time employees or doing something creative with the money that we've already got to meet those obligations to make sure the county doesn't get in trouble. So we're going to look at all that, see how we can tie that all back together with our staffing. A couple of things that have affected us, particularly like your critical access hospitals now do not do some services that traditionally have been done here or Highlands. Used to your small hospitals do a little bit of everything. Highlands now, for instance, does do surgical procedures. You may have something done here cardiology-wise that needs to go to Asheville. We've seen a lot more trips taking patients out to other facilities. We do a lot of trips to Transylvania County because they do urology. They have urologists on staff. So we've seen a lot more transfers out of patients that previously we probably didn't handle in any county somewhere. So that's been a little bit of an issue for us. We've also been a little proactive on things. When I tell you that a lot of times we'll go to Asheville or go to Mission, some of those trips are instigated by us. We actually met with Dr. Maddox with Asheville Cardiology, and there are certain cardiac patients now that we don't even stop at the local medical facility. If it meets certain criteria, we have an agreement with them in order to meet the 90-minute time frame that they want us to meet to get a patient from the residents when we first made contact with them to where they have a balloon therapy or something at Asheville Cardiology. We have to go from the residents straight to Asheville. And we've done that on occasion, which again will put us into an issue for medical staff. So we're going to look at all that, try and tie that back together, come up with a good option for you. One other project that we're working on that I mentioned last year, which is a little more involved than I actually thought, it's called Community Paramedic Program, or if you look at it, you see it used, it may be called a Mobile Integrated Health Care Model. The Affordable Care Act and hospitals and changes in the medical profession, patients and medical facilities, particularly medical facilities, are going to be penalized if you have patients that are readmitted into a medical facility within 30 days when they're discharged. If you come out of Angel Medical Center and you go back for almost any reason in the next 30 days, the hospital takes a cut on money because of the fact that maybe they didn't get something, they missed something, they didn't follow up, they didn't check on patients. One of the things we looked at last year was seeing if we could do some sort of a model where, for instance, if we took somebody home that had a serious medical condition at a medical facility, within the next 3 days we do a visit at the home. We go talk to them, and it may be nothing more than them making sure that they take their medication. It may be something simple, just checking on them every so often. What that does is it saves hospital money, it saves us trouble in the long run because we don't have to go back and pick those patients up and transport them, which puts a strain on our system. And it may even, one of the things we looked at is the volume of patients we have prior to the medical facility, our frequent flyers, for lack of a better term, folks that have a chronic condition that we're familiar with, that we transport on a regular basis. Maybe we need to be a little proactive. We visit those folks ahead of time and help them keep their things in order at home, which frees up more ER bed space, frees up the hospital, and things such as that. And I have to basically throw an attaboy out there for Sheila Southern. Sheila is the chairman of a care transition team in Macon County that y'all may or may not even be aware of. She works with all the medical facilities, including Angel Hospital, Highlands Cashers, to monitor these readmits and see where we're falling through on these patients. Macon County is the only county that anywhere west of Asheville that has an active group which actually has the data to support what the problem actually is. And that's a big plus for us. So we're non-capital equipment items. We've got some IV pumps that roll, some smaller things that need to be replaced. I'm a big fan of planning 10 years ahead of time and buying 1 or 2 things each year. So we're going to try and come up with a plan to replace that stuff to make sure we stay on track.
How has the service been with you?
It's been okay. We've had a couple of issues with maintenance as far as not being very maintenance friendly. For instance, heating system is very difficult to get to, which requires a lot of labor time to disassemble stuff to get to what the actual problem is, which is in some cases a $3 hose. But so far we haven't had a whole lot of downtime this year.
Any amps that would be good for trucks?
realistically, we need to replace 20 here. Derek and I had this conversation with 5 frontline trucks. I don't like to come and say I need $300,000 one year and then ask for zero the next year. For budgetary planning purposes, it's much easier if I come to you and say I need this smaller amount every year for the next 10 years to make it easier to plan. That's the way I like to budget, and that way we don't get my hands somewhere.
But 9 weeks you were talking about, that ended when, so you done a snapshot of 9 weeks, you done budget to this.
That was from December 31st up until about the middle of October. That 9 weeks. Which is actually our slow time.
That was a slow time.
What's missions ambulance here now? They're still on day shift? They're doing night?
They are. They're actually still on day shift, but we have arranged a meeting with Jason Hunt, who is the new medical director for all the critical access facilities the mission has in this area, and the transportation director over the helicopter and the RTS, the ground ambulance program for mission, with Highlands Cashers and with Angel Medical Facility on next Friday, whatever that day is in Highlands. So we're going to get together and discuss the issues. One of the things we talked about when I met with Angel and mission folks about 2 weeks ago, we're going to look and see if there's some way we can streamline that call process, because we figured out it's very confusing for hospital staff to know who to call, when to call. And if it goes to mission, I have no problem if they just try and call us. The hospital staff don't have to call multiple people. We've had a very good relationship with mission. So I hope that'll pan out for us in the future for that.
How are you doing sheriff's courthouse? Got the additional crew. I understand there's some issues there, but overall,
we have had very few times that we have actually run over our volume where we've missed our minimum staffing, as long as we've got the 5 trucks. There were probably, that I know of, 2 instances in the last 2 months when we tried to call in another crew because all our trucks were busy. One of those cases, it was handled by a supervisor until the other truck could get there. And in the other case, the other trucks freed up within about 5 minutes and were able to get to another call and pick up the. So honestly, it has been a world of difference for us. Our biggest struggle has been always, since I started in 1995-ish till now, is handling your out-of-county transfers. It's a balancing game between what needs to be left in Macon County to take care of the people in Macon County and the people that need medical treatment somewhere else. And unfortunately, at some point, we're the only game in town.
See at some point talk about the revenue structure, making sure we're prepared for the counties. Like to see that people are using the service or stay in the community.
We're glad you're back to using home.
Yes, sir.
Any other questions?
You said your minimum staffing numbers. That's based on
Call volume and 20 years of fishing. We have found out that based on your call volumes, Manahale EMS will run about 150 to 200 calls a year. Highlands will run between 400 to 500 a year. And the other, subtract that from 6,200 and some odd calls a year, the rest of those are in the Franklin area. We have determined over the years that as long as you can manage those effectively in the county, 4 trucks will basically keep us available about 9 people. And that's the industry standard. 90% of the time, you want to be able to call me and for me to be able to automatically send you an ambulance out the door ready to come to you, not dealing with her, and then you have to wait on me to finish her before they come to you. But 90% of the time, they need to be able to leave my door to come straight to you. And that's where we go with you.
Thank you.
Thank you.
Thank you.